When we go on Medicare, we have two big choices to make. Number one, what kind of plan are we going to use? But secondly, what company are we going to use? And so what we're going to do in this video is we're going to talk about both of those, what plan options we have available and what companies. We get a lot of questions about Aetna and Blue Cross and Blue Shield, so we're going to compare those companies and the plans that they offer. So when we made the decision to go on Medicare, we actually have two different insurance systems available to us. And I'm going to talk about both of those. Just a quick overview. First off, some people will choose to enroll into traditional Medicare, original Medicare we call it, and then get a supplemental plan to fill in the financial liabilities that they have in original Medicare. The second system is to enroll into Medicare A and B, but instead of being under the A and B system, you now have a private health insurance company that's replaced A and B for you called the Advantage Plan. And so these are two options, and there are, of course, lots of companies. We're brokers. We write for many of them. But tonight, I just want to really talk about Aetna and Blue Cross Blue Shield, very popular companies. A lot of people ask us about them. So in this video, we're just going to compare those. There are, of course, multiple carriers throughout the country. But let's talk first about Aetna and then about Blue Cross as we compare these two different types of insurance plans available. All right, so first off, I want to look at staying in the original Medicare system. So option number one, those who stay in that system. The reason people get supplemental plans is because there are financial liabilities in A and B. And remember, the only thing that original Medicare pays for 100% is preventive services. So beyond preventive, we're always going to have some kind of balance of the bill. And you can see, of course, here on the computer, there are actually gaps. These are financial liabilities you're responsible for, gaps that Medicare says you will pay. There's 3 gaps on the A and 3 gaps on the B. Just real quickly, you can see on the A side of Medicare, our first gap is the deductible. Now, this deductible is what we have to pay the hospital for a hospital stay of up to 60 days. It's only $1,632. The bill could be $500,000, but you pay $1,632, and Medicare pays the rest. Now, what's unique about this deductible is it can be multiple times in a year because it's tied to a benefit period. So when I'm admitted to the hospital, I start a benefit period. When I'm discharged, I still am in the benefit period for the next 60 days. So if I'm discharged and within 60 days I go back to the hospital, I'm under the same deductible, same benefit period. But if I'm hospitalized, discharged, 60 days goes by, nothing happens to me, but happens after that 60-day window, I have to be rehospitalized, I would pay another deductible in the same year. All right, now the next gap is for extended hospital stays. Frankly, these are rare. They occur, but not often. But you can see month 3, you have to pay a $408 a day copay. Month 4 and month 5, you pay $816 a day. So month 3 out of your pocket's $12,000. Month 4 and month 5, $25,000 out of your pocket. So very substantial gap for extended hospital stays. And then skilled nursing is when someone goes in for rehab, maybe after a stroke or a hip replacement. Could be an accident or fall or injury or something. They go to skilled nursing. Here's the rules. Medicare says first 20 days in the skilled nursing facility, they will pay everything as long as you're in the hospital 72 hours or longer prior to going to skilled nursing. 72-hour requirement. And then after that, Medicare says the first 20 is on them, and then the next 80, they'll pay for everything, but you have to pay a daily copay this year of $204 a day. They say right now the average stay is about 35 to 40 days. So first 20 is on Medicare, and the next 20 days or so, $204 for you. Now the B side of Medicare is the outpatient side. Remember, A is inpatient, skilled nursing, hospital bills, those kind of things, and hospice, but B is outside. B is outpatient, everything that we do outside the hospital on an outpatient basis. Part B will pay, plus all the doctors. Whether the doctor is someone that you go to see in their office, outpatient, or they come to see you in the hospital, inpatient, B always pays the doctors. So primary care docs, specialists, anesthesiologists, surgeons, hospitalists, ER doctors, they're all paid through Medicare Part B. So we have a deductible. It's not like the A deductible. It's once a year. This year it's $240. That deductible is a calendar year deductible, which means it resets every January. It's not prorated. It's the calendar year, however many months are left in the calendar is that deductible. And after we met that small deductible, after that, Medicare pays 80% of the bill, and you pay 20%. Medicare pays 80% as long as 2 things happen. Number 1, you see a Medicare provider, and number 2, whatever you're having done is a service covered by Medicare, which is almost everything. And so it's 80 by them, 20 by you. Last item that's a gap is called excess. This is 15% that a doctor can legally add to a Medicare bill. Now, I want you to know something. Excess charges do not occur frequently. probably less than 5% of the time this will happen. It does happen, but not often. And this is a doctor that sees Medicare patients, will bill Medicare, but they will not agree under a contract to accept Medicare reimbursement rates as payment in full. They add to the bill. And when they add it, it's 15%. Medicare allows it, but Medicare doesn't pay any of it. You're responsible for that. So you see we have 3 gaps on the A, 3 gaps on the B. So if someone doesn't like this amount of liability, they can transfer most of that liability away today. And frankly, about 70% of all people buying supplemental plans are getting a Plan G because of this reason here. The only liability they have after they've purchased the Plan G is the Medicare B deductible, and that's just once a year. So that G plan is almost full coverage, not quite. We used to have a full coverage plan. Most people can't get that today. That was called the F plan. But the G plan is the closest to full coverage. So once a year, whatever the B deductible is, you would have to meet that. It's going to cover all the other 5 of the 6 gaps. That's the G plan. The second most popular plan right now, 30% of all people are getting is an N plan. Different letter, so we have different type of coverage. And you can see the same gaps. That gap system is here. So if someone has an N plan, what's going to happen? It's going to cover 4 of the 6 gaps. N plan will not cover the B deductible, just like the G didn't. But here's the difference. G covered excess, but N does not. So if and when you were to have an excess charge, and again, a very low risk in this, but if you did, that doctor would be paid by you on the excess charge. So if a surgeon was approved for, let's say, $5,000 surgery, and there was excess involved, 15% would be $750. Medicare allows the doctor to bill you that $750. N will not pay it. G, of course, would. And then N has a couple of copays. They're very reasonable. But every time you see a doctor, you're subject to a copay of up to $20. It could be $12, could be $18, could be $16, but it can never be $25. It could be the most $20 copay every time you see a doctor. And then if you go to the emergency room, unless you're admitted to the hospital, you would pay a $50 copay for that. All right. And so you're going to see here a difference in premium. Obviously, we have difference in coverage, so the premiums will vary. So let's do a quick comparison now as we look at Aetna and Blue Cross Blue Shield on the G and N plan. So first off, when we buy a supplemental plan, in my example, just, this is a zip code that's in Texas, in Dallas area. And when we buy a plan, we buy it based upon our age, our gender usually, and then also if husband and wife are going to be on the same plan, there's a household discount. So this is a couple that's turning 65, getting plans, and this again is zip code in Texas. And so we're going to look at Aetna, Plan G, and Aetna Plan N, and Blue Cross as well. So you're going to see here that the male rate is higher than the female rate. And this is pretty well true throughout the country. There's some places where it's the gender neutral. Those would be community-rated states, but the majority of states still today are going to have a difference in premium. Men do pay more than ladies, so you can see what it is on that G plan with Aetna. Now, Blue Cross right now a little bit more competitive. Normally in most markets we see Aetna being competitive here, but really in this area they're not. You can see Blue Cross, at $30 a month cheaper. Now, keep this in mind. When you buy a plan like this, the coverage is always the same. The only difference is the premium initially and the stability of the rates. So we look at that for sure. Female for Aetna, $150. For Blue Cross, $126. So definitely Blue Cross a bit more competitive here. So that G plan is going to do what? We pay this premium to either Aetna, Blue Cross, or whoever you go with, and they're taking all that liability except for the B deductible. The N plan is going to be cheaper. We take a little bit more liability, excess charges, a few copays. With Aetna, the N plan, $119.23 for the man. Lady's going to pay $103.66. And then notice the Blue Cross, a little cheaper than Aetna. But you'll notice here on the N plan, Aetna's a little bit more competitive now, right? Which tells me as an agent, I look at this and say they don't really care if they write G plans in this particular zip code in Texas, but they are interested in the N market in that area because they're much more competitive. And so that N plan, of course, not covering quite as much, but still a very, very good plan, really, with either one of these carriers. But keep in mind, as I said, we're brokers. I just selected these two because a lot of people ask us about Aetna and Blue Cross. All right, so that takes us through all the details when it comes to the one option we talked about, and that's A and B with the supplemental plan. Next, we're going to look at the Advantage plans. We're going to compare again what these two companies are offering in that market. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so let's get into the details details of these two particular companies and the plans that they offer. Now, in this particular market in the Dallas area, there's actually 41 different Advantage plan options. Okay, so again, these are just the two, but these are kind of things that I would be looking at if I were going to be going on an Advantage plan. You're going to notice first off that both of these plans have a zero premium. Now, I have to be enrolled into Medicare A and B, and so unless you're on Medicaid, you have to pay your Part B premium right now. That's $174.70 for most people. And so, but there's no premium paid to the Advantage company because now we're going to pay as we go as far as co-pays and things like that on the majority of our services. All right, so you're going to notice here first off that there is no deductible, which is good, meaning that we don't have to pay a deductible prior to starting seeing the health plan beginning to pay. Now, you will see here a medical out-of-pocket maximum. And so each plan is required to set a maximum, and Medicare gives them a real large range, but both of these carriers here are very similar. You can see Blue Cross $5,900 max out of pocket, Aetna on this plan $6,350. This just simply means that we'll never have to spend any more than that throughout the year as long as we stay within our network. And so if the bill at the hospital was $100,000, you're not going to pay that. If you had a serious health problem, you'll probably hit this max for the whole year and then you're done. And then those maxes reset then every January. All right, so you see doctor office visits for both of these carriers is zero in the networks. You can see your primary care at a zero copay. Specialists, Blue Cross is $30. You can see Aetna is $35. Now, you'll notice here Aetna continues to let us know that if we go out the network, we have a 40% coinsurance. We're going to have something very similar with Blue Cross. They're just not, they haven't told us that yet, but it will come out here a little bit later in the report as to what we would spend out of pocket if we went out of the network. Now, notice for skilled nursing, we're seeing here that in-network for Blue Cross is zero for the first 20 days. The same above the 20 days, then we have a $203 a day copay, the very same thing we would have just in traditional Medicare. But look what Aetna has. They have a $10 copay for the first 20 days, and then again that typical $203. So again, Blue Cross certainly is more advantageous in that regard. Home health care, both of course are going to be zero. When it comes to mental health issues, when it comes to health care, for outpatient, $30 for Blue Cross, $35 for the Aetna plan. Emergency room, $120 for both of these. And you'll notice that if a person goes to the emergency room and they're admitted to the hospital, they always waive the copay to the ER. Hospital stays, now notice a little difference here. With Blue Cross, our copay is $300 a day up to 5 days, which means from the 6th day thereafter, there is no out-of-pocket expense. Now, let's say I go to the hospital and then, 6 months later I go in again and we would still keep paying the daily copay. But once I've hit my limit, I'm done. So I'm done after 5 days with Blue Cross. I'm done after 6 days with the Aetna plan. So again, Blue Cross kind of more favorable in that regard. I do want to clarify something about this copay, whether it's $300 or $335. Every service that we have that day is covered by the daily copay. You could have a couple doctors see you, you could have a surgery or not, you could have multiple scans, but whatever services we get, whether a little or a lot, that daily copay will cover all of them. The Advantage plan would be responsible for the rest of the expense. Okay, you can see your Part B give back. This is when an Advantage plan pays money towards your Part B premium, which means it brings it down from that $174.70. Again, most PPOs don't offer that. In fact, most plans don't offer it. There are a few that do, but neither one of these are going to reduce your Part B premium for you. All right, so when it comes to drug plans, hopefully you can see this on the screen here, but very, very similar. You'll notice so that Aetna is a little favorable here. If you have a Tier 1 preferred generic, both are the same zero, but Tier 2 generic with Aetna is going to be a zero copay, $8 on the Blue Cross plan, $47 for Tier 3, which are preferred generics, $100 each. So very similar, other than that Tier 2 medication costs you a little bit more on your Blue Cross and Blue Shield plan. All right, so now what I'm going to do is I'm going to dig into the details more of these plans, and so we'll look at Blue Cross first, and then we'll conclude this by looking at Aetna. So we're going to go to the plan details here, and learn more about this particular plan. So what I'm looking at here are going to be some of the additional things that Blue Cross may be adding into the plan. We've seen some of the main stuff, a doctor visit, specialist visit, what it costs to go to the hospital, those kinds of things. But let's look at what it's going to cost us, though, to have an ambulance ride. If we have to go to the hospital, $275 copay with the Blue Cross Blue Shield plan. Then notice this extra benefit put in here called the over-the-counter item. These would be things like, Tylenol or aspirin or supplements, just different things that you would not need a prescription for, but they're allowing a $50 benefit on a quarterly basis. But notice what they're also doing. If you don't use it in one quarter, they roll over to the next quarter. So basically what they're saying is $200 for the year, we give you this opportunity to buy over-the-counter items. You do it online or through a catalog, and they'll actually ship these things to your home at no cost. Some companies offer a quarterly amount, but they don't carry it over. So either you use it or lose it, but not so with Blue Cross. It continues to carry over if it's unused. Okay, you can go to the chiropractor for $20 inside. The network, podiatry, $45 as well. You'll see also oral exams. You're going to cover some dental things here. Look at eyeglasses here. Notice this one. Routine eyewear, $125 plan allowance. Limited here for routine eyewear. So they'll contribute $125 just throughout the year for either contacts or lens and frames. Okay, hearing aids, they offer a copay plan here, $699 to $999. That means they probably have some pretty decent different hearing aids within their plan because we see a copay there. Sometimes we'll see a copay as low as $300 or $400, usually not very quality, but here we see some probably decent hearing aids that would be within their system. Okay. And routine hearing exam, of course, $0 as well. And we already talked about the Part B give back, and they do not. And then fitness benefit. So you can join their Silver Sneakers network. A lot of gyms and community centers, places like that would allow you to go to their facility at no cost. Now, remember earlier we talked about out-of-network. I want you to notice something here. Look at this little issue here. When it comes to out-of-network with Blue Cross, we now have a deductible. Remember, in network, we were $0 deductible. Here, if we got a network, we have to pay the first $750. But notice, we also now have a higher max out-of-pocket. I think their plan here, if I'm not mistaken, was about $5,900. Now this is a combined. It's not $5,900 plus $9,550, but now it has increased. If we go out of the network, we could spend almost $10,000 out of network. And you can see that out of network doctor visits are $30, the specialist $75, and these things will just continue to go up and go up. All right, so that's the Blue Cross Blue Shield. Let's look at the details here on the Aetna plan. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. All right, so we're going to look now at the Aetna Medicare Freedom Plan, some of the additional benefits. We've seen a lot of the main services, but let's see exactly what they're going to offer. So we see an ambulance right here, $265, a little cheaper than what Blue Cross was. We're also going to see here the benefit of the annual physical. You get one of those once a year. We did not see that in the Blue Cross and Blue Shield plan. Silver Sneakers, also part of this one, so you can go to any kind of a gym or community center that takes Silver Sneakers. You can go to them at $0 cost. Now let's look what they're doing on the dental. Dental here, we have, looks like oral exam $0, cleaning $0, x-ray $0 as well. And then it looks like to me what they're going to do on the other services, restorative, non-routine services, looks like they're going to pay anywhere between, you would pay anywhere between 20 to 50% coinsurance. Preventive dental out-of-network will be 30% coinsurance. So really not a real attractive dental benefit here on this particular plan. Most companies are going to at least cover the preventive at $0. But what's happening here is if you need anything beyond that, then you're going to be out of pocket quite a bit. When it comes to eyewear, remember the Blue Cross plan paid $125. Here, what they're saying is that there is going to be just a $0 copay for eyeglasses, and that's probably certainly going to be, some provider that's going to provide this within the network. Hearing aids, you'll see the copayment. Again, a little bit better than Blue Cross here. We're seeing here we've got some fairly low copays for hearing aids. And so the whole point is these added benefits here. When we look at these plans, we got to say, okay, we got to be happy with the network. We got to be happy with our max out of pocket. Got to be happy with our co-pays. But then we get down to really some of the nitty-gritty details to make sure that we're capitalizing on some of these additional perks that these companies are offering. Let's keep going here. We see the over-the-counter benefit. I think on the Blue Cross, I think it was $50, and it carried over throughout the year. And so what they're saying here is it's $75. It's put on an over-the-counter health card and wellness, so there's other things that you're able to get here. And I don't see any issue here about them carrying it over. So a plan that doesn't usually say it's carryover tells me that $75 is probably you have to use it or lose it. We could, of course, dig into another page that they will actually give us the details on that. But usually when I see that not being mentioned here on the surface, that tells me probably not going to be carried over. All right, so those are the things that we're going to look at. And just keep in mind, folks, whenever you decide to go on Medicare, it really boils down to these two decisions. Do you want to be in the Advantage system, or do you want to be on a Medicare supplemental plan? I do want to just close with this, because about half of all people are going on subsidy, half are going on Advantage plans. And so really the only thing that these two systems have in common is this. You have to be enrolled in A and B to have a supplemental plan or an Advantage plan. But when it comes to using those services, there are some things that are a little bit different with Advantage versus subs. With Advantage plans, remember, you're always going to be on a network plan, either an HMO or a PPO. If you have a supplemental plan, you can go to any provider as long as they take Medicare. So we call that open access versus networks, which means if I have a network plan on the Advantage, there could be some limitations. Not all doctors take them. Fewer take the HMO than the PPO. If you have an HMO plan, you must always have to have a referral to see a specialist. If you have an HMO plan, you can't go out the network. We saw in the PPO we can, but it costs more to do that. The second big item that differs between these plans would be pre-authorizations. Now, pre-authorization means that you need some kind of a healthcare service where the doctor makes a recommendation, but the insurance company has the final say-so. So if you're on an Advantage plan, that happens about 70% of the time. A doctor recommends, but the Advantage plan must agree with the doctor's recommendation and approve it before it's paid for. And sometimes they do approve them quickly. Other times they delay them or deny them. They have the right to do that. If you have a supplemental plan, that can't happen, because if Medicare says they'll cover something, doctor says you need it, the insurance company cannot intervene in any way. They have no say-so. They have to follow the Medicare rules. All right. And then lastly, we have to be mindful that Advantage plans are a pay-as-you-go system. We've seen that. We pay Medicare Part B premium, but we usually don't pay a premium to the insurance company. Okay. But we pay as we go until we hit the max out of pocket, and those again will reset every January. With the supplemental plan, we're always paying a premium to get rid of the majority of the liability we have, whether we use services or not. But if I have an illness, almost always you'll spend more money on your Advantage maxing out than what you would on your premiums on your supplemental plan. All right. And so again, they're both insurance. They just work differently. So we as an agency like to take the time to be sure we look at both options for sure. Now, I can tell you that most agents push Advantage plans because they pay the agent a higher commission. We don't do that. We certainly write Advantage plans because sometimes it's a very good option. It's the best option for certain people, because some people just simply cannot afford or don't want to afford an additional premium for the supplemental plan. So we want to find the very best one of those that we can. But when you can afford a little extra to get that supplemental plan, I think people enjoy knowing they don't have to worry about networks, they don't have to worry about pre-authorizations, and plus they have a plan that's going to last them for the rest of their life, because it can never be canceled by the insurance company other than non-payment of premium. So as you can see, it's a big decision, and we'd be delighted to help you and walk you through the entire decision so you'll have the confidence knowing that you have chosen not only the right insurance option, but also the right company.